Hello and welcome to the introduction video for the FCM Toxic Syndrome Simulation event starting on May 6th. On behalf of the UVA Simulation Collaborative team, I want to sincerely thank you for helping out. The event truly could not be a success without you. By the end of this video, you should understand how the event will unfold throughout the day and what your general responsibilities are. The simulation will occur in two general locations, with mirror setups so two groups can run through the simulation simultaneously, completing the event faster. The School of Nursing Simulation Center, located on the second floor of McLeod Hall, right next to the Claude Moore Medical Education Building, will host one series of simulations, while the Medical School Simulation Center, located on the ground floor of the Claude Moore Medical Education Building, will host another series. If your group will be at the School of Medicine, guide your students to the ground floor of the Claude Moore Medical Education Building. You should see a sign when entering the Simulation Center, directing your group to the waiting room. Bear left when entering, and it will be the first door on your left. There will be signs directing you to the proper location. Please remain in the waiting room until one of our specialists retrieves your group for the room orientation.
Hi, welcome. I'm Cindy Dillette, and I'm going to take you all to go ahead and begin your FCM experience, and we'll go to orientation. Come this way.
Upon completion of the orientation, our simulation specialist will escort you and your group to room PR5. It is here that either Dr. Littlewood or Dr. Abatsis will begin the Case 1 pre-brief. It's at this point that we ask that you separate from your student group. You'll follow the simulation specialist down to the control room where the first case will occur. It's here that you'll have the opportunity to discuss any questions that you have about your upcoming case, case number 2, with the simulation specialist, and to hash out any last-minute details that need to be covered in order for the event to be successful. Once you're done doing this, you can report back to the pre-brief room, PR5, with your student group. When it is time for Case 1 to start, Drs. Littlewood or Abatsis will escort you and the simulation participants to Simulation Bay ER, while the students observing will remain in PR5. Once the case is over, you and the Case 1 participants will gather with the observers in PR5, and debriefing of the case with either Drs. Keith Littlewood or Vi Abatsis will begin. Upon completion of the Case 1 debriefing, Drs. Littlewood or Abatsis will escort your group to room PR2, where you will await the start of the next case. Case 2 will begin when a simulation specialist, acting as a distraught embedded participant, will alert your group in PR2 that her colleague is unresponsive in the bathroom and needs help.
He's unconscious and I don't know what to do. I need some help.
Okay.
At this point, all of the participants from Case 1 will stay in the observation room with you to observe, while those who are observers for Case 1 will now be participants and will be escorted to the patient, which will be in PR1.
This is Mike. We're sitting down for dinner and he said that his blood sugar was feeling low. He came in here and he didn't return, so I came to look for him.
The patient in Case 2 simulates the victim of an opioid overdose.
You okay? So,
Is there anything I can do?
call for help. Can you call 911, please?
Yeah, I'll go call him. Thank you.
Let's lay him down.
When the students find the patient, they should begin their BLS primary survey. They should lower the patient completely to the ground and then assess for circulation, airway, and breathing. And they should discover that the patient has minimal respiratory effort and a very slow rate. For circulation, they should be able to palpate central pulses, although they may be weak with a slow rate. It's important to note that no resources will be provided to students to assist in ventilating the patient, such as a bag valve mask or pocket mask. It's at this point, if they have not done so already, they should be activating the emergency response system. If the students fail to activate the emergency response system, the simulation specialist, acting as the embedded participant, will cue the students to do so.
Do you know his medical history or anything?
If the students ask about a medical history, they'll be provided with a non-specific response that does not indicate anything about opioid use.
No, I just work with him, and I think he said something about he was feeling weak, he was going to check his blood sugar, and then he just kind of disappeared. We didn't eat anything yet, we just ordered drinks.
Does the restaurant have an AED or anything?
I'll go check with the restaurant manager.
The patient's belt should be found removed and lying next to him. If pockets are searched, a bag of a powdery substance will be found, along with single-dose intranasal Narcan.
All right.
Help on the leg?
All right, look at his arm.
A more thorough assessment of the patient will reveal track marks along the right antecubital area.
Okay, yeah, we could probably really use the.
Additionally, meiosis will be present in both pupils.
I'm seeing pinpoint.
Yeah, they're real small.
Yeah.
What do you think's wrong?
Students should begin to review the facts of the case, coming up with a differential diagnosis. Hopefully, they determine that opioid overdose is the most likely scenario, and they begin to administer the patient's Narcan.
Well,
You can see his breathing. Just real slowly.
yeah, and then, so we've got this track mark here, which is, it's concerning, and then, I did find the Narcan, and you've got,
Found this.
is there anything else in the trash can that, would give us any other kind of indication?
If the students are very thorough, they will also find a used needle and syringe in the trash can.
There is a needle in here. I don't know if I'll touch it.
Okay, all right. So I'm gonna, based on all of these things with the pulse, not much breathing, and the pinpoint, I'm gonna go with it. We need to go ahead and administer the Narcan, the possible opioid overdose.
Narcan.
Ready? Here we go. And I'm glad this will be quick acting for him.
If the students do elect to give intranasal Narcan, the patient will quickly recover and make audible vocalizations as the emergency services crew arrives.
We're taking care of you.
Oh, sir.
Hey, you guys call for EMS?
Yes, we did.
What's going on?
Upon arrival of emergency services, the students should give a proper report, transfer care, and the case will successfully end.
Guys, thank you. My partner's on the way in with the stretcher, so I'll take it from here.
Great, thank you so much
You're
for your
welcome.
help.
Appreciate you.
If the students elect not to give Narcan, the responding EMS provider will give it when they arrive.
We're gonna try the Narcan, see if that works. Narcan administered. Sir! Hey, there you are. Yeah. Yeah. Seems to be coming back around. All right, guys, thank you. My partner's on the way in with the stretcher, so I'll take it
Upon completion of Case 2, the students will report back to PR1 where you will conduct the debrief.
from here.
Great, thank you so much
You're
for your
welcome.
help.
Appreciate you.
Debriefing is a student-centered practice, not faculty-focused. This means the process is intended to elicit reflective thought and self-discovery. As a debriefer, it is your job to help facilitate this process. Start out by saying something to the effect of, "All right, nice work in there. We're going to take a few minutes now to talk about the simulation. I can see what you did and said, but I don't know what you were thinking. That's what I'm interested in talking about now. The thoughts that drove your actions during the simulation." You'll want to explore how the learners are feeling about the events that occurred in order to guide them to a shared understanding regarding the facts of the case. Say something to the effect of, I would like for us to express how we're feeling regarding what just happened during the simulation.
I think you guys, it's a lot of work in there. I see that Chris was in here watching y'all's performance in there. I'm interested to see what you guys thought about that experience outside of the clinical setting. What type of feedback do you guys have? Chris, your input also is valuable in this performance too.
Well, I was like, kind of had to quick switch gears, you know, when we first started. I wasn't expecting like somebody to come down and say, hey, we need help, we need help. But once I was able to quick do the, you know, switching the gears, then I was able to get into more of like, you know, my doctor mode role.
Yeah, understand it, and that insight to performance that you're jumping quickly into that patient experience there down the hallway there.
Yeah.
Little adjustment there.
Yeah.
Yeah, okay. Yeah, grab your bearings.
Yeah.
Brad, what did you think about that?
When students express feelings regarding the events, begin to make a point regarding what actually happened and what was perceived to have happened. For example, if a student states,
I just felt helpless because we were outside our normal environment and I didn't have any of our normal equipment.
Yeah.
And then there was just a period of time where I was just felt like I was sitting there waiting and I couldn't do anything.
Yeah.
you could follow up by stating, being outside the normal clinical environment certainly leads to a unique set of challenges that we have to solve in ways we may not be accustomed to. Refrain from talking anymore about this event and take note of it for later, while the other students are given the opportunity to share their feelings.
I would just say that they did a good job assessing really quickly what they needed to assess to figure out that what was going on with them and to try to treat them as best as they could with what they had.
Yeah. I think one thing that you guys also did very well, being in that outside setting, you thought about the AED.
Respond in similar ways, which advocate for how the student felt while restating the facts regarding their experience. After this, it is time to address some of these facts through the frame of the student's experience and allow them to reflect deeper and begin to self-discover. Start by saying something like, I want to take a minute to discuss the experience y'all had regarding the lack of typical resources. I heard that you felt helpless. I saw that you went straight to providing rescue breaths and trying to obtain a pulse while your colleagues stood by. I'm curious as to what was driving your decisions at this point. Allow the students to respond and begin self-discovery.
Just decided not to do compressions because he was still breathing and had that slight pulse. But
Build upon this process by continuing to inquire about their actions and responses that led them to possible solutions. It is at this point that using effective teaching strategies such as compare and contrast, pros and cons, clinical stories, and/or group discussions may be necessary. An example might be, let's talk about what the pros and cons would be about searching the patient's pockets for clues.
I mean, you know, I just want to make sure, okay, here's the boundaries, but at the same time, like, we've got somebody that's like in serious
confidentiality.
Yeah,
boundaries,
I mean, serious distress. So, but then once we found what we did, we felt like, okay, that gives us more information. So
use these methods and attempt to talk less and listen more for an effective debrief. Once the debrief has ended, your students should scan the 2 QR codes in the debrief room to complete the faculty evaluations and the student survey. The event will conclude once the evaluation and survey are complete.